Hello, it's Carla here. I'm here today to talk to you about your Makarlu product and how to use it. What you'll find is that when you get your product, you'll get them like this, either as a pair or singly. What you'll find is that there are different components that can be used individually or together. Your starting point is the timber dome. Now you can use this dome, you just click it off like that, and you can use the dome like this to support your hands or wrists, but we also use it for a number of our other exercises, and we will show you how to use that. You flip that over and you can then use this dome like a rocker, but also as a slider for your feet and your hands for certain exercises. You can also do this exercises on the domes, on the rocker, and you can work like that, or with your hands like this or your feet on here, and it can work in multiple planes like individual rocker boards for each hand and foot. The next part is we just click this off. Remember, it's magnetic, so this means that you will be able to use this on a fridge or a filing cabinet when you want to do things upright. The next is that you have a look in here. You will see that there are little hooks or bigger spaces, and that's where you put your fingers in to take the domes out. And you'll see that there is one bigger dome, a middle dome, and a smaller dome. Each of these domes can be used individually or in conjunction with each other. If you want to make this heavier when you stand on it or use it for certain pressure exercises, you can just add the middle dome in. You can make it even heavier by adding the little dome. Every exercise could be graded this way depending on your need. Thank you and enjoy. Today we're going to look at some exercises for lower back problems in specific situations of what's called a facet joint problem for your sacrum and your lumbar spine. So you would have been told by your physiotherapist that you have a particular problem, either an extension or a flexion problem on one side of your body. This program we're talking you through is about how you will work on your extension-sided problem. Okay, so just so that you understand, facets, or the fancy word is a zygapophyseal joint, is how your spine sticks together, and they sort of hook in like this. Now this area can often degenerate through age or injury, and it's a particular problem in the lumbar spine and L5-S1. So often people will come in with a lot of pain in this area. This exercise series is about helping you do some self-management at home. Okay, so our starting point with the Makarlu is I'm going to start Mary first of all by taking the timber base, and she's going to lie on her back and she's just going to put that underneath her lumbar spine where the arch should be. Okay, Mary, just like that. Just take a deep breath in. Does that feel comfortable? Yeah. Now this is just about bringing awareness of where the arch of your spine should be. You don't have to do very much. You just have to stay there and just breathe in and out. Slowly just giving yourself that little bit of awareness. Nice. Is that okay?
Yeah.
So let's just lift your tush. Take this out and lie back down. Feels okay?
Yes.
Okay, so what we're going to assume for this particular session, and you need to apply this to yourself on the basis of what your physiotherapist has told you. So in this case, we're going to assume that this side, is that your right? Yeah, okay, good, I'm not very good, is going to be her extension biased side. So in other words, this is a side in which the extension, that's when you put your back like this, so your pelvis goes out like this, into a painful situation. So Mary, what we're going to do is we're going to take the Makarlu and I'm going to take the outer dome only. So the little domes we're going to leave behind. So you're going to lift your hip up and we're just going to roll it onto there. Is that okay?
Yep.
Now, What I'm going to get her to do is just roll, not out. Just drop the hip. Yeah, good. How's that feel?
Feels okay.
No pain?
No.
Okay. Remember, if you think about pain on a scale of 1 to 10, if you feel that this pain is above a 4, possibly above a 5, stop. It is not good. Keep yourself around that 4 to 5 scale in pain. Okay? How's that?
Yeah, it's good.
So you can see really what I'm trying to do is get Mary to flex in her hip here, back and forward. Good. No pain?
No.
What I'm going to do now, Mary, is I've taken the timber base and I'm going to get you to put that over here and put your foot over there. Good. Just try and get the arch activated. Feel like the heel and the big toe are coming together. Good. Feel that?
Yeah.
And back. So you would do this maybe up to 20 seconds, 20 or 30 reps if this is what you need to do. I really want to encourage you to get your flexion happening on this side. So I'm just going to get you to lift this up and you're just going to roll down. Oh, nice.
Looks better.
Yeah, there. So what we're going to say is that on this side, Mary's trying to avoid extension. So what you will often find is on the opposite side of your body, you're actually going to have to do a little bit of extension or movement pattern different to release the muscles on that side. So we're going to once again insert the little Makarlu dome. Now if you feel like you can tolerate more, you put more of the domes in, but I'm going to keep it only on one dome now. So Mary, I'm going to get you to keep this leg here. Don't let that rock over, okay? And I want you to feel the arches of your foot stay in contact with the dome. Then you're going to roll the leg out to the side. Good. And back. So here we're trying to get her to release through her piriformis. No pain?
I can feel the release. Okay.
Okay, that's good. And what I want you to do, so Mary's being a bit rushy here, so what you're wanting to do is go a little bit slower. Try to take about 5 to 10 seconds to go there. And now, when you bring it back, I want you to try and bring a focus to the inner thigh muscle about halfway along and feel like that muscle, if you can, is contracting to help you bring that leg up. I can see by your face that that's just, it's not as pleasant as one would like, but you're the one with the back pain, so let's see if we can work through with this. And you just drop out and back in. Okay, now you can see what Mary's trying to do. She's trying to be her super ballerina self and start to turn her leg out on this side. And we really want you to try and keep this leg parallel, okay? In other words, ballet feet, we want your feet to stay a bit like that, okay? And just one more time. Good work.
Thank you.
It looks so easy, it's actually a lot harder. Nice. Pelvis is sitting a little bit better, but I can see that this side still needs to do a little bit more work. So what you do is you take the other timber base and you are just going to slip this back under your sacrum this time. So Mary, you just find it where it's comfortable. Is that okay?
Yeah.
Now I still want you to keep this timber base here so that you keep the inner thigh active. And you're just going to rock back just a little, just into a little bit of flexion, and then just straighten it out. So the base is actually just going to be like this, very small movement. We're not trying to go woo-hoo-hoo-hoo. We don't want to give you seasickness. Just back and forward. And I do this about 10 times, each time slowly feeling that as you roll in, roll the femurs together a little bit, and that will help yourself roll your back. Okay, just roll the femurs together just a little bit, back and forward. Nice, Mary. I'm just going to slip this out from underneath you now. Good work. So, what I'm going to get you to do now is I'm going to get you to work on opening out the front part of your thigh. Okay? So I'm going to put this under this foot. Okay? And you're just going to slide that leg out. So we're using the base of the dome as a slider and back. I think, Mary, I need to put your heel on here a bit more. Is that okay?
Yes.
And I might even, to help you, just put this here so that you don't, yeah. Is that better?
Much better.
Okay, so that you know what I did, I took, use the black base so you can see, I put the pink dome here, so her foot is here and rolling. Good. This time, as you go there, I just want you to dig the heel into the timber base and then roll back, slowing it down. Good. Nice. And what you can add to that is that you can add the special treat, take the big dome only, put it back under here. We're going to do two things at once. You're going to roll this leg out. Nice. And back. Is that okay?
Yeah.
It's intense though, isn't it?
Yes.
It's all right. And so for some of you, this would only be a little each day, slowly building up to the full program. So just go 1 or 2 steps as your physiotherapist instructs you. Good. So then, Mary, what I'm going to do is get you to bring this leg up to your chest, if you can. Is that okay?
Yeah.
And then I'm going to get you to put your hand here and this hand here onto here. Okay, just first of all, just feel like you're rolling your spine back, okay? Now, I'm going to slip the dome out. Oh, that's much better, isn't it?
Yes.
Okay, now, if you can, take this leg up in the air. If you can't, don't worry. I would get you to put your foot onto a wall and press into the wall if you need to, okay? Hold that there. So Mary, I'm going to get you to curl up, across there, and then cross over to this leg. No, this leg here. Rolling back. Gaze towards the camera. They really want to see your pretty face. And there. Good. And then down. And pressing down. Imagine you're pressing into the wall on that side. Rotating across and back down. Okay. And then one more time. Good. And then you're just going to take this leg down and take this leg down. Now you would only do everything I've done on the one side. Don't try and go and do all of this program and then go and do it again on the other side. It is designed to do different things on each side. How's that feel now in your pelvis?
That's good.
Okay. Are you able to roll up now? And we just go into 4-point kneeling, please. Just goes, oh. Just stay that way. And what I'm going to do is, now that we've done all of this release, she's going to have to do some work for it, okay? There's no need that we can't just do treats, okay? So put this underneath your hands, and I'm just going to just quickly put that together in an ever so professional way. One there and there, okay? And so then, Mary, what you're going to do is just rock your hands back and forward first, okay? Back and forward, and then roll your wrists around. Okay. So now what we're going to do is take your legs a little bit wider, just a teeny bit wider, okay? And I'm going to get you to try and roll your femurs in. Don't start from here. So wrap the femurs in so that you can roll the sacrum back. So we're doing cat, angry cat. And then Mary's going to press the sits bones away and the top of the head away, just to there. You do not want to go into extension. So Mary, you're going to press away, bottom away, head away. Activate through that entire sling. And then I'm going to get you to roll around and back. So you don't want to go into the cat-cow. We just want to go into the cat and then into just a straight back. So if I had a ruler here, it would stay straight. 4 more, please, Mary. How's that feel?
Feels good.
Okay, no pain?
No.
Good. Now, in Mary's case, we had one side that we were working only in flexion. That was her right side. Now, I want you to keep that in mind and consistently work on that side. But for the purposes of filming, we're just going to swap the side over. So Mary, can you just put your knee on here? Okay, and I'm going to take this away. So you would only have one set at home. And I'm going to put this here. And so Mary, I just want you to slide that knee forward. Yeah, curling the spine as you do so. And back. So remember, this will all be on the same side that we started at the beginning. So the side that you want to avoid the extension. Nice. And a couple more times. Good, Mary. And final one. Nice. So then, if you can just put your bottom back on your heels, please. Oh, yes, she says. Yes, yes, yes. Put your hands on there. And we're going to put your hands on there. So we've just put her hands on the timber domes and they're upright. So Mary's going to slide her hands forward and then curl back in child's pose. Trying to get that little bit of flexion in the spine. Okay? How's that?
Good.
Can we do 6 more like that? Feel like you roll back. And curling back up. Really try to make the work happening in the base of her spine. It's delicious. There's no other way to describe it. Good. Now, Mary, can you take yourself to the side? Yeah. And press the rib cage into my hand on this side. Nice. Then back. And then take yourself to that side and press your ribs like that. Oh, so snake-like. Good. And one more time. One more time on each side. Good. Then bring your hands to the center and then roll back. Lovely work, Mary. How's your spine feel?
Feeling great.
Done. Thank you and enjoy.